Good afternoon, ladies and gentlemen, and certainly welcome back to the Cancer Control Society Convention, Labor Day weekend 2010. This is the 38th annual convention, and we're very happy to have you. Our next speaker is going to be on this platform for the first time. It's not his first time at the convention, but it's his first time up here in front of all of you. Dr. Nezami got his basic education and training overseas, came to the United States. He's done internships and fellowships, University of Southern California, University of California, San Francisco, and a number of other training, teaching. He's also teaching. One of the things that really impressed me about Dr. Nezami is that as we talked about his case histories and the patients he's helped, he's been able to help some cancer patients with non-toxic, nutritional-based modalities without alienating the conventional oncology establishment in Fresno, California, where he lives and works. That in itself says a lot about his work, and that now even some of them will refer their patients to Dr. Nezami. Dr. Nezami, thank you very much for being here.
Thank you, Frank. It's a pleasure. Thank you. Well, good afternoon, everybody. As Frank mentioned, I have extensive training in conventional medicine. So I would say that some of the speakers come here and they attack conventional doctors. I would disagree with them. I think that conventional, even oncologists, they have contributed to the health of some cancer patients. Being said that, I also have major concerns about chemotherapy and conventional treatments if they are given blindly. So what I think is that if we combine the both methodologies, both natural and conventional medicine, we can get the best results. So a little talk about quality of life. Quality of life is something that when a patient goes to an oncologist, I always ask them to inquire about it. Because when they go to the conventional oncologist, especially if they have advanced cancer, the oncologist already knows that their treatment is not going to work. But they call it palliative chemotherapy. So they say, okay, you have a big tumor in your lung and it's so big that it's causing problem and may get to the heart. So we're going to do some chemotherapy to shrink it, although you're going to die in the same amount of time. So it's palliative. But guess what? You're going to lose your quality of life. This is the only time that they use the word palliative when they take away the quality of life. I don't understand it. Do you understand palliative care when you take away the quality of life? But, you know, it's called palliative chemotherapy. And even for the patient who does not have an extensive disease, when they go to the oncologist, they ask about quality of life and they say, well, you're going to lose your hair and you're going to throw up all the time and then you're going to have severe side effects of this chemotherapy. But you may get so much sick that all of a sudden the cancer is gone. Or you may die. This is not what the patient needs to hear. Patient needs to hear that we have a treatment that is effective. It doesn't cause you to go through the suffering of the chemotherapy. And it's promising, and you can live a normal life. This is what a patient needs to hear. And it's available, and it's possible. And we just have to use the science instead of doing what the insurance pays. So with knowledge, there is long life. That's why you're here. And that's why when you leave this room, you are the messengers to other people who have cancer or have family or friends with cancer and they're suffering because they don't know. So if you know that there is another treatment that works as good or even beyond the standard of conventional oncology, I would encourage you to save their lives, because that's why I'm here too.